Welcome. This webinar is brought to you by the New Hampshire Training Institute on Addictive Disorders. You can access the recording of this webinar at our website, www.NHADACA.org. After completing this webinar, please upload and complete the quiz if you're interested in receiving a certificate. You can find the quiz in the file pod on the right or visit our website at NHADACA.org or email us at thetraininginstitute@NHADACA.org. You can also email, mail, or fax a completed quiz. The contact information is on the quiz itself. If you are a member of NHADACA, the certificate for this webinar is free. If you aren't a member, the fee is $15. You will receive a certificate worth 1 CE once you have completed and passed the quiz and paid for the webinar, if applicable. Through the New Hampshire Training Institute on Addictive Disorders, this one-hour event is pre-approved by the New Hampshire Board of Licensing for Alcohol and Other Drug Use Professionals, as well as the NBCC. If you have any problems viewing this webinar, audio problems, or any other technical questions, please contact us at 603-225-7060. Please email any questions regarding the materials you see today to the Training Institute at NHADACA.org. You can find or upload these introduction slides in the file pod to the right of your screen. I will now turn you over to Kelly Reardon to talk about the Core Function 3, Orientation.
Thank you, Carrie. Welcome, everybody. This is the third part of a 12-part series, and today we're going to be talking about the Core Function number 3, Orientation. A little bit about myself. That's me there on the screen. My master's in education and a CAGS in counseling, and I'm also a master level alcohol and drug counselor. My job right now is I'm the Associate Professor of Human Service in the Addiction Counseling Program at NHTI in Concord, New Hampshire. And I also serve as the Addiction Counseling Program Coordinator there. So let's get started. Core Function number 3, Orientation. Throughout today, we're going to be focusing obviously on the Core Function number 3, Orientation, but its importance in substance use counseling. And just as a little reminder, because you can view these webinars in any order that you wish, we've been talking in succession about the core functions, and so I'd like to just jog everyone's memory that core function number 1 is screening, core function number 2 is intake, and today is the third webinar on orientation. Some of the objectives today that we're going to be discussing is knowing the definition and the global criteria for Core Function 3. We're going to know and understand the steps of the orientation process. We're going to also be looking at the ASAM levels of care. We're going to talk a little bit more about ASAM, standing for the American Society of Addiction Medicine, and talking about the levels of care. And finally, we're going to be looking at client rights that are applicable in the treatment program. So let's get started with the IC&RC's definition of orientation. Orientation is describing to the client the following: the general nature and goals of the program, rules governing client conduct and infractions that can lead to disciplinary action or discharge from the program. If it's orientation to a non-residential program, the hours during which services are available is discussed as well, along with treatment costs to be borne by the client, if any, and client rights. So to kind of put this in just everyday terms, orientation is the process that's very similar to informed consent. You are describing to the client what is expected of them and also what they can expect from you, the program. So a lot of things can be encompassed when talking about expectations of the program, and we're going to talk about those today. Along with describing the nature of the program, the goals, the rules of the program, a lot of this is about trying to help, for lack of a better word, orient the client to the program. You want to help the client be successful. You want the client to know when they come into your program what they're going to be doing, right? So I often think about this as if I'm going to be a guest in a hotel, maybe a guest in a house. I'm there for a certain amount of time, and I don't know how they operate, because chances are the hotel or the friend's house, they don't operate the same way that I may operate at my own home. So I want to know things like, where are the bathrooms? What time is breakfast, lunch, dinner? When do I have to be at certain groups or events that are happening? Who will my counselor be? And when do I meet with my counselor? And how about, when do I get free time? When can I call my family and let them know how I'm doing? So all the types of things that we may want to do when we're on, let's say, a business trip in a hotel, we have to understand that our clients are going to want those same types of questions answered for them. They are coming to our treatment program as a guest and a consumer and a client, and we need to help them feel at their temporary home that it's a safe place. And that's where it comes into play, that orientation is not simply about just touring your client and letting them know, hey, the first door on the left is the bathroom, but really helping them feel at home. This is their home for the next however many days, and you want them to feel like they're comfortable, and that if they need something, they know who to go to get that need met. So orientation is a really great time to do some work in building trust and rapport with the client. Now, orientation can be done in a group, but more often, just for comfortability and to build that trust and rapport with the client, doing it individually or one-on-one really helps to add to the intimacy of the relationship and trust factor. So a good rule, if you can, is to try and take the client individually so they get your undivided attention. And sometimes people feel a little more comfortable asking questions if it's just on a one-on-one basis versus a group. So thinking about the fact that this is a great time to really build that trust and rapport with the client, and try and take them one-on-one to give them that special intimacy factor. Now for the global criteria. So remembering again that global criteria is what every substance abuse counselor should know how to do within the core function. So first, under the global criteria for orientation, is to be able to provide an overview to the client by describing program goals and objectives for client care. This is what the program is trying to accomplish. These are the goals of the program. And to reach these goals, these are the things we would like you as the client to do. And as a program, we will support you in meeting your objectives to meet the program goal. So pretty simply, if your goal at your treatment facility is to help a person enter the path of recovery and to get well, you are going to have them attend one-on-one counseling to develop a treatment plan. You're going to have them, another objective may be for them to attend a relapse prevention group. Maybe another objective is to attend a 12-step meeting. Whatever the objectives within the program are, they are things that you're asking your clients to do to reach the ultimate goal of the program, which in this example would be entering the path to recovery and wellness. A second global criteria under orientation is for a person to be able to provide an overview to the client by describing program rules and client obligations and rights. So you, as an agency worker, need to know those program rules and be able to explain them to the clients very clearly. Also, having things written down about the program rules or client obligations and rights is very helpful because it's something that the client can take with them, because you're going to be throwing a lot of information at clients, and it's going to be nice for them to have it also written down so when they forget, they can look back at their paperwork and be reminded. So global criteria number 2 is to provide that overview to the client verbally as well as written. We're going to talk a little bit more about that a little later on in the webinar. But you have to know your program rules, know what the client obligations are, and what the client rights are within your program. So very important to be able to express it once you know it. The third global criteria is to provide an overview to the client of program operations. So this is a little bit like my example earlier about maybe being on a business trip in a hotel, right? What time do things happen? Same thing with our clients, right? So what time is breakfast? What time does a client need to be in the dining room, and where is the dining room in order for them to have breakfast? And what time does lunch start? And when, what happens if they're late to lunch? Do you just let them starve? Well, that wouldn't be a very good guest or host, excuse me, that wouldn't be a very good host operation. So you might say, if you happen to be doing something during the lunch hours and you miss lunch, you may go into this refrigerator, make yourself a sandwich, etc. But helping them understand, if I miss this during a time frame, this is what I can do to eat, for example. So helping them with what time, lunch, breakfast, dinner, all that is. Also letting them know when maybe visiting hours are, if that's applicable at your agency. Letting them know what time they can make phone calls. Letting them know what time group is and what room is group and what's the title of the group, right? And, an objective might be, why do I, right? A client could ask, why do I need to go to this group? And that's where you would sort of bring in the objectives and the program goals. But being able to tell a client what they're supposed to be doing at what time, where they could go to get the service that they need, and what to do if they're outside of that time frame, right? So helping a person be successful within the program. A purpose of the orientation core function is to provide the client with the ground rules that they need to follow in order to remain in good standing. So this is a little bit about, this is a further extension of the conversation. We want our clients to be successful. So we don't want to set them up to break a rule. And we would set up a person to break a rule if we didn't tell them that a certain action was against the rules. So you have to help a client understand, if you do this, this could occur, right? So these are our ground rules, and if you break one of these ground rules, this is the infraction. This is the discipline that comes from that. So you're going to want to probably start off with some of the big ones that could lead to a person possibly being discharged from a program. You know, my experience has been most of our clients, they want to stay in good standing, and a lot of them break good standing because they didn't understand that their behavior or their action was against a rule. Maybe they didn't get good orientation, or they forgot, or whatever the thing is. Helping our clients consistently understand what's expected of them and what the ground rules are is really important to the success of their treatment, right? They can't get treatment if they can't stay in the program, right? Another purpose is that orientation also addresses the goals and rules of the program. And it's really important to be clear, right, about what's expected in terms of conduct, as well as the obligations to attend their one-on-one therapy or their group or what have you. And again, talking about those infractions, right, that could lead to disciplinary action or even discharge from the program. So we'll talk about this in a little bit, so I might be jumping the gun here, but the more clear we are, the more chance our clients have of understanding. And the more repetitive we are with client conduct, infractions, program objectives, etc., the more a client hears it, the more likely they are to retain it, therefore are more likely to follow it and more likely to stay in good standing within the program. So being clear in that repetitiveness can really increase the chances of a client being successful within the program. Another purpose, orientation, details what occurs throughout the day, their schedule, and a tour of the facility. So I think I've talked in some length here about letting the clients know, okay, 7 a.m. is breakfast, 6 a.m. might be wake up and showers, 10 o'clock might be your first group, etc., right? So that's what occurs throughout the day. That's their schedule. But I think sometimes we miss helping clients understand where these events are supposed to happen. So I think, and I really do think it's an honest mistake in my experience, it's usually been because we go to the facility every day to work and we do this orientation, day in and day out, 5 days a week or more. Maybe we've worked there a couple years. We might take for granted that everybody knows where the bathroom is or everybody knows where the dining room is, right? It's remembering that our clients, this is the first time for a lot of them that they'll be seeing the inside of your facility. So treat them like a guest in your home, as though you were a concierge in a hotel and this is a brand new city for a client, and give them a tour. And don't whiz by rooms, right? I see a lot of people sometimes taking a client through for the first time and just sort of walking the halls and talking to them extensively about deep things while they're in the hall, and then just saying, oh, over here on the left is this, over here on the right is this. Like, no, right? Because they're trying to listen to the detailed information you have. They're trying to take in a new surrounding. They're not seeing the what you're pointing at. They just know, like, okay, somewhere on the left here is the bathroom, but I'm not sure exactly which door because there's 2 doors here on the left, right? So slow yourself down. Try and keep the heavier conversations, if you will, the conversations that have a lot of information in them, keep those to a point where it's you and the client, one-on-one time. When you're doing your tour, it's time for a little friendly chit-chat, that building of trust and rapport, and also taking the time to show them the door on the left, walk into the door on the left, and show them the room, right? And spend a second or two in that room so they can orient themselves, right? So really, again, when you're doing the tour, consider yourself a person that's, a cruise director, right? You're giving a tour. You want to make sure that your guest feels as comfortable as possible. Another purpose is that orientation really begins before any treatment begins. So very, very important for you to remember that a person needs to go through orientation before assessment, treatment planning, counseling, and all of that happens, right? It's part of the beginning phases of treatment. I did talk about this a little bit, but I really want to bring home a point about orientation in particular, is that I need people to really remember that for a client in their early first few days of recovery or shortly thereafter from a detox, the client's memory may not be functioning at its best. Right? So they've just already been through trauma, right? You could consider a detox a trauma, right? They really don't feel good. It's a very hard process for them to go through. The addiction themselves has caused trauma. Chronic long-term use, right, has affected the brain, therefore the memory. So remember, our clients, not only their memory may not be functioning well, but they're also not feeling well too. So you're going to have to slow down, repeat yourself with ease, right? It's so easy for us when we're feeling good to go through our day and we just bang, bang, bang. We know this information, we just talk about it, no problem. You have to understand that this is the first time a person's coming through. They may not be feeling well. Memory could be affected. So slow down and do it and repeat yourself and do it with compassion. Right? Try not to get frustrated if a client is asking a question on something you just said. Repeat yourself. Right? Repetition helps with memory. Right? It helps with learning. That's why I repeat myself constantly through this webinar. No, that was a little side joke. But seriously, repetition does help with retention. So try and relax, put yourself in their position, right? Have empathy and compassion and repeat yourself, be patient, and help a person to feel at their most comfortable level. More purposes, along with describing to a client their rights as a client and the privileges they have as a client, a conversation needs to occur around confidentiality and the rights a person has to be treated professionally and receive professional treatment. So very, very important. I think sometimes people say, well, I just do the orientation around here. I don't really need to know the confidentiality and privacy rights, and you most certainly do. We can't talk enough about confidentiality for our clients. This may be something we hear day in and day out. It may be something we practice at our agency day in and day out. It may be something we hear in our supervision day in and day out. But this is not everyday language. It's not an everyday occurrence for our clients, right? They don't know what we know day in and day out. So we may have to talk about it several times in order to help a client understand how confidentiality works within their treatment, right? So talking to them about, you know what it's inaccurate to say whatever you say here stays here, right? I find I've heard clinicians saying things like that before. And of course, we know that's inaccurate. So please, I think clinicians or workers in the substance use profession will want to try and build rapport and trust, so they say things like, yeah, whatever you say here stays here. And that's just inaccurate, because there are clearly exceptions to the confidentiality rules and regulations, and you need to help make your clients aware of those, right? They have that right to understand that. So going over confidentiality, going over, what they discuss with their counselor is protected under confidentiality, but has its exceptions. Also talk to them, your clients, about what happens with the paperwork that you're filling out, right? So in the orientation phase, there's quite a bit of paperwork, because you want your clients to sign things that say they have been informed of the rules, they have been given a tour. And we'll talk about this in just a little bit more detail in a few minutes. But the client has already probably done a lot of paperwork in the intake core function, and they're going to do a little more paperwork in the orientation. Paperwork never really stops throughout the treatment. So helping clients, again, understand, well, what happens to the information that I put on the paperwork? What happens to the information that someone working with the client puts on paper? Is it protected under confidentiality? Is my chart protected under confidentiality? So helping, again, a client to understand what their rights are, right? They are certainly have the right to ask about what is going on with their treatment and the paperwork that's involved with the treatment. So again, having that conversation, and maybe several times, to help a client understand just what does confidentiality mean, and what's covered under confidentiality and what's not covered under confidentiality. I repeat this several times because it's something I want you to retain. It's never enough to just hand a client paperwork. And I really can't stress that enough. Clients deserve and have the right to professional treatment. And professional treatment is not just going up to a client, giving them a schedule of the program's activities, and walking away. That's unacceptable. You always need to be having a verbal dialogue along with a tangible piece of paper that the client can take with them. So with the verbal and the written documentation, a client has a better chance of understanding, retaining, and has the ability with a verbal dialogue to ask any questions that they might have. So again, super important for us as workers in the substance use profession to, not just throw a bunch of information at a person and then at the very end of an hour-long session say, hey, does anybody have any questions? No, you want to be giving a little bit of information. Stop. Here's a piece of paper that highlights what we just talked about. And also, I'm wondering, do you have any questions about this? And then really putting forth the effort to answer the question the client presents, and making sure that the client is satisfied with the answer, right? Feeling that their question has been answered and that they're comprehending the explanation. So I already talked a little bit about the fact that there is a lot of paperwork involved in the orientation phase, but it's important, right? Because the amount of paperwork, although it might be time-consuming, really reduces the risks of misunderstandings and legal issues that could occur, right? So sometimes our clients might say, well, this wasn't talked to me. If they're on the verge of getting discharged from the program, they might say, well, I was never told about this, right? And then you would have the ability to pull out a piece of paper that shows, well, you signed off on the rules, you were given a copy of the rules, and I gave a verbal explanation of the rules. It's all documented on this day at this time, right? So it gives you a little bit of leverage when you're trying to help a client be accountable, right? So careful written documentation is, it protects you and it also protects your program, right? So making sure you're getting all the documentation signed and dated, as well as writing a progress note after the orientation for the client's file that highlights what you did, what you talked about, and questions that were answered, along with the date and the time that the orientation happened. So in a little bit, I have a slide about a sample orientation checklist, but every agency will have their own way of doing this. But I like the orientation step list because I think it really helps you go step by step and you don't miss anything, right? Because like we've talked about, there's a lot of things to cover in the orientation process. So you want to be sure you've checked off each one, you've covered each one, and answered any questions within each one. So you should take each portion of the orientation step by step, and as you're going through each step, have the client sign off on it, initial it, etc. Again, like I just talked about, after every single phase of the orientation, stop, ask, do you have any questions, and answer those questions to the best of your ability, but also so that the client, feels satisfied with the answer. They may not like the answer, but that's different than having a full answer so that the client understands it. And then you would follow up with making sure the client understands each phase and procedure of the orientation process. Right? So after you give your explanation, you might want to say, does that make sense? Do you understand the process as I've explained it? We've already talked about the fact that an oral discussion has to be had in addition to the paperwork. And, when I was talking about it, I was saying about retention, right? So having that oral conversation allows for questions. Having the paper could be risk management, but it could also be something for the client to look back on because they're going to forget some of the stuff that you tell them. But also, it could be an issue where your client is not able to read. And if a client's not able to read, how do you know that they can't read? Right? Because you're going through the orientation phase, you're talking, you're having a dialogue, you're giving them the paperwork. In my experience, I have given people who do not know how to read paperwork, and they have it down to sort of a science where they look at the paper as though they are reading, and they've become very good at this because they don't want people to know that they can't read. So they've developed a way of acting as though they are reading, and I have had no idea. So one way that you can sort of double check this is, as you're going through the orientation phase, ask the client to read the rules with you or to you as you're having the conversation. So maybe you read the first rule and then you say, how about you read the second one, right? Or say, in order to really get involved with this, so it's not me doing all the talking, how about I read one and you read one? And then you might be able to find out some information. You want to be very sensitive to this too, because you certainly don't want to embarrass anybody or put anybody on the spot. Okay, but it might be a way for you to really ensure that your client is actually able to comprehend what's on the paper. And again, we've already talked about documenting every attempt you make to clearly convey information verbally during the orientation process. Another issue, so we talked one about a client being illiterate, but how about if a client's primary language is not English, right? And this happens very often. So a program's response to this issue might be that they have program materials printed in languages that are common within the program's clientele. So certain agencies I've worked at, we've had a strong population of Spanish-speaking, Mandarin-speaking, and French. We've had French. So we've had our program rules, orientation packets printed in those 3 languages to help a client have the orientation packet in their primary language. So again, this is another place to really remember that in early days of recovery, especially, memory may not be functioning well. And there could be a whole host of other things adding to lack of comprehension. And that could be just the anxiety of being in a new place, the anxiety of going through treatment, right? There could be co-occurring things happening. So please don't get frustrated with people, right? And especially if there's language barriers or literacy barriers, we really have to act with compassion and empathy and repeat ourselves or problem solve, right? It doesn't help for me to keep repeating things in English if my client doesn't understand English, right? It involves me problem solving and trying to find the material in their primary language, finding an interpreter or something of the kind. So really, again, slowing down, having empathy, and having compassion. Orientation is a time to describe the details of how the program operates with the goal of the client to function independently over time. Right? I think we've talked quite a bit about this, but autonomy is our goal, right? We want a client to be able to make decisions within their treatment, to own their own treatment, right? And we just sort of help guide them along. Here's the sample orientation checklist that I talked about. I like this. It has the name of the client, then the person doing the orientation. So this is the name of counselor or staff, but whoever's doing the orientation really puts their name there. The date of the orientation. You might also want to do the time, right? That could be helpful sometimes. And then it goes through 7 different components of the orientation. So nature, goals of program, rules and regulations, consequences for infractions, etc. And then you would just go through and have the client initial 1 through 7. As you go through, number 1, for example, explanation of nature and goals of program, you would talk about that. You would stop. You would ask the client if they had any questions. You would answer the questions. And then you would say, does my explanation, make sense to you? If they say yes, sounds good, whatever, then next to number 1, they would initial it. Then you go on to the next, explanation of rules and regulations, etc. There's a little section on this checklist that has an area for you to note any issues or problems that might arise during orientation. So this might be a place where you discover that a client is illiterate. This might be a point for you to put that there and how you're going to problem solve that. Then the client signs it with a date, and the person conducting the orientation signs it and dates it as well. And this would go into the client's chart. So we're going to switch gears quickly here because one of the objectives of today's webinar is to talk about the 5 levels of care according to ASAM. And we've talked about ASAM standing for American Society of Addiction Medicine. And these are the 5 levels of care. So you'll only see up to Roman numeral 4, and that's because they start with 0.5, which is early intervention. Level 1 is outpatient services. Level 2 is intensive outpatient services or partial hospitalization. Level 3 is residential or inpatient services, and level 4 is medically managed intensive inpatient services. And we're going to break these down one by one. Level 0.5 early intervention is more for clients who've shown a pattern of alcohol and or drug use that's problematic. So this could be this is something I saw early in my career. I worked on college campuses and I worked in a prevention office. So if a student got caught drinking in the dorm, we would try and pull them in, talk to them a little bit about the risks and the choices that they were making, and maybe do a brief screening, like a cage or an audit, something like that, to help them see that maybe their choices about alcohol and other drugs are leading them on a path to more risky issues down the road, right? So it's really about education to increase the knowledge of alcohol and other drugs and help people make better choices if they choose to partake in alcohol. Level 0.5, right? I think we've already talked about this, but designed to increase, right, knowledge and awareness of substances and to help people make healthy decisions. Level 1 is outpatient services. So this would be very similar to a person, staying at home, staying with their job, doing their life, but they go, to a building, they have their one-on-one session maybe with a counselor for an hour, and that's what they do for the week, right? So that might be a really typical example of an outpatient services. But outpatient counseling and education occurs at the outpatient service, level 1. The goal is usually lifestyle, attitude, and behavioral changes around their alcohol and other drug use. It's organized, low intensity, and like we said, non-residential. The duration and frequency, like my example was, it was a 15-minute, counseling session downtown at the community mental health center, let's say, for example. But duration and frequency really is based on the individual need, right? Depends what the person might need. So level 1 is designed to treat clients who show maladaptive patterns of substance use. The goal in outpatient is permanent change in a client's substance use behavior. And we've talked about that it is organized, low intensity, non-residential, and it is treatment that addresses lifestyle, attitudinal, and behavioral issues. We've talked about duration and frequency. Clients are often seen in regularly scheduled sessions, and it could be anywhere from 1 to 9 hours a week. Level 1 also includes treatment for a client with a stable mental illness who's ready to focus on the co-occurring substance use problem. Level 2 is the intensive outpatient or partial hospitalization program, which is highly structured education and treatment. It's designed for clients with serious substance use issues, ranging maybe from moderate to severe. It's highly structured, day or evening, and it focuses a lot around education, right? It's 9 or more hours a week, and it starts to introduce abstinence as a lifestyle. The good thing about level 2 is that, again, just like level 1, it allows the client to apply new skills in the home environment. So people, again, it's non-residential, yet it's intensive. They're getting a lot of good treatment and education, and it's intense, but it also allows them to continue their home life, their work life, their family life while getting this intensive treatment. So they don't have to go away for 28, 30, 90, 60 days, etc., to receive the intensity skills, right? They can do it while staying in their home environment, and then they can apply the skills they learn from their level 2 treatment into their home environment. So a really nice choice for people. Level 3 is residential or inpatient services. This is the 24-hour program. This is where people pack up their bags and go to a treatment facility for a number of different days. It used to be 28 days, 30 days, 60 days, 90 days, right? All depends upon the program, but they are, to be level 3, they have to be structured 24-hour programs. They provide safe and stable treatment environments with a positive recovery enforcement. During level 3 care, people develop sufficient recovery skills while living in a supervised community. So somebody's always there, 24 hours, it's staffed, and somebody's always awake to assist with issues. And there are 3 clinical levels of increasing intensity of care. So there's level 3.1, level 3.2, level 3.3. Okay, and each one is more intense in their care level. And the last one is the medically managed intensive inpatient treatment. This is 24-hour medical management. And really the purpose of level 4 is to stabilize substance-related or psychiatric symptoms before moving a client onto a clinical treatment setting. So I really think about medical detox when I think about level 4. Right? Stabilizing a person medically before they can go on and get clinical treatment. Level 4 includes all the services of an acute care hospital or a psychiatric hospital that may be needed for severe and unstable substance use and or psychiatric symptoms. Right? The purpose, like we just talked about with level 4, is to stabilize a person medically and then move them on to a clinical treatment program. Okay, now these are my references. So I'll let you look at those when you want to. And we have a couple questions to make sure everybody's on the same page here. Question number 1. Orientation always happens after screening. True or false? Give you a second to kind of think about that. And the answer is false. Orientation happens after the screening and intake core functions and before any treatment begins. Question number 2. Orientations may be done in groups or individually. True or false? The answer is true. Although orientation can be done in groups or individually, it's preferred to do orientation individually because it really adds to the intimacy of a one-on-one professional relationship, and it really allows that rapport and trust. And again, also something I think is that it allows a person sometimes to ask questions that they may not feel comfortable asking within a group setting. So if you can, do it individually, but sometimes that's not possible and you need to do it in a group setting. That is the end of today's webinar on core function number 3, orientation. I hope you've enjoyed our time together, and stay tuned for the next core function number 4, assessment. Goodbye to all. Hope you enjoyed. Bye-bye.